Now with Dr. Darien giving tips on how to prepare for an emergency room visit.
Yeah, there's some basic things everyone should have. If this is a reminder, I hope it is. It's remembering to keep your paperwork. We're talking about past hospital visits, past surgeries, past procedures, also a list of your medications, and I think most helpful, the names and numbers of your doctors. As an emergency physician, follow-up is really important for us, so making sure that that patient has a contact point, and also contacting their primary doctor is something I often do, but when you don't have that number, sometimes it can be really difficult, especially in a busy day.
So you're basically telling us we have some homework to do today,
You've
because
got
nobody plans to go to the emergency room.
I know, and that's why I think you should always have an emergency folder in your house so that, God forbid, you have to do it, you have something to grab so that you can go. It's just, for an emergency room visit, there are so many things that go on. Being prepared helps to ease that frustration and hopefully make it faster for you.
And it seems obvious, but why is it important to know your medications when you're going in?
Well, often during an emergency visit, we'll have to give medications. I'm stabilizing certain conditions, and if I don't know your prior dose, sometimes it can be more difficult. That can take more time and can delay your care. And so knowing your medications, knowing the dosage that you're on, knowing your allergies, and even possibly having your pharmacist number can be helpful, because often I'll have communication with the pharmacist, help me understand what medications have recently changed so that I can give good clinical care.
Also, we've talked about this a lot, but it takes a long time when you go to the emergency room.
I'm so happy you brought this up. I'm so happy you brought this up. We were just talking about the average time at an emergency visit, remembering it's 4 to 6 hours on average, and sometimes it can be a lot longer, especially if that waiting room is full, so you got to come with your patients.
That's a long time.
It's an incredibly long time, and that is just in general. If you can imagine, when you need things done, procedures, when you need dosages or medications, sometimes it can take even longer. I'm often reminding patients about this, but again, patience is key.
Right back, your patience.